Are you tired of conflicting diagnoses and treatments for your lower back and leg pain? Imagine finally understanding what's really going on with your body and getting on the fast track to relief. This video will finally reveal the hidden truths about SI joint dysfunction, sciatica, and disc issues. It is frustrating to bounce between doctors and treatments only to end up with more questions than answers. This video is your guide to cutting through the confusion and finding the real root of your back and leg pain. We will explore the sacroiliac joint dysfunction, sciatica, and disc bulge in a way that's never been done before. With these expert insights, you will be able to differentiate between SI joint issues, sciatica, and disc problems with ease. You'll learn key indicators for each condition, making it simple to understand your symptoms and communicate them effectively with your healthcare provider. Stay tuned until the end of the video, where I'll share 3 exercises to relieve lower back and leg pain. Keep watching. Welcome to World Class Chiropractic's official channel. I'm Dr. Peter Turner, one of the dedicated chiropractors here at World Class Chiropractic in Ellicott City, Maryland. Our mission is to help you achieve your health goals, whether it's reducing pain, improving mobility, or enhancing your overall well-being. At World Class Chiropractic, we specialize in treating conditions such as low back pain, sciatica, neck pain, upper back pain, shoulder and arm pain, headaches, and more. Our expert team is committed to providing top-notch care and personalized treatment plans for each patient. Now, before I dive in, be sure to subscribe to our channel if you want expert tips, effective strategies, and practical guidance to help you live a pain-free, healthy, and fulfilling life. We upload a new video every week. Although SI joint dysfunction and sciatica and disc bulges can present with similar symptoms, it's important to distinguish their unique clinical signs and presentations for proper diagnosis and treatments. So what are these key differences? First, let's talk about the SI joint dysfunction. The sacroiliac joint connects your spine to your pelvis. Dysfunction in this joint can cause pain that is typically felt in the lower back and buttocks region that can sometimes radiate to the groin or upper thigh. Key clinical signs include pain that worsens with standing, walking, or climbing stairs, difficulty with weight-bearing activities, and tenderness over that SI joint region itself. You might experience stiffness or even a feeling of instability in the pelvis. Now, during a physical exam, if you are suffering from SI joint dysfunction, you may notice an increase in pain over that SI joint area during an orthopedic test called the FABER'S test. During this test, a practitioner will have you lie on your back, place your leg in a figure 4 position while stabilizing the opposite hip, and they will apply a force, pushing your knee down towards the table. Next, we have sciatica, which is often caused by compression of the sciatic nerve. This nerve runs from your lower back through your hips and buttocks and down each leg. Sciatica is characterized by a sharp shooting pain that radiates from the lower back down the leg, often affecting only one side of the body. Other symptoms include tingling and numbness or weakness in the affected leg down to the foot. This pain worsens typically with prolonged sitting, standing, or movements that really stretch that nerve. Now, during a physical exam, the straight leg raise test is a great indicator of sciatica. During this orthopedic test, the practitioner will slowly raise the patient's leg off the table, and this will reproduce that shooting pain down the affected leg. Lastly, when we talk about lumbar disc bulges, these occur when the discs between the vertebrae in your lower back protrude out of their normal space. This can put pressure on nearby nerves, causing pain. Symptoms of lumbar disc bulge include localized lower back pain, pain that radiates down into the legs similar to sciatica, and sometimes muscle weakness or numbness in the legs. Pain from a disc bulge often worsens when bending, lifting, or twisting. Similar to sciatica, the straight leg raise test can be an indicator of a lumbar disc bulge, but is also often accompanied by muscle spasms and tenderness found during palpation of the lumbar spine, along with a limited and sometimes painful range of motion. It is important to note that these conditions can have overlapping symptoms, making a professional diagnosis essential. If you're experiencing any of these symptoms, consult with a chiropractor to determine the best course of action. Now let's dive into the practical part. I'm going to show you 3 exercises that you can do at home to help you relieve pain in your lower back and legs, regardless of which condition you may have. First up, we have the glute bridge. This exercise strengthens the glutes and the lower back and helps stabilize the pelvis. First thing we're going to do is we're going to lie on our back with our knees bent and feet flat on the floor, hip width apart. Next, we want to engage our core Squeeze our glutes as we lift our hips off of the ground, forming a straight line from your shoulders to your knees. We want to hold this position at the top for a few seconds, then slowly lower our hips back down. With this exercise, we want to aim for 2 to 3 sets of 10 to 15 repetitions. This exercise is great to create stability in the pelvic region, reducing strain on the SI joint. The next exercise is the bird dog exercise. This exercise helps improve core stability and balance. Now, starting on all fours with our hands directly under our shoulders, knees under our hips, we want to extend our right arm forward and our left leg straight back, keeping your back flat and engaging your core. Hold this position for a few seconds, then return to the starting position. Switch sides and repeat. We want to aim for 2 to 3 sets of 10 to 12 reps on both sides. The bird dog exercise strengthens the muscles that supports the spine, helping to reduce any nerve irritation. Finally, a partial crunch is an effective exercise used to strengthen the abdominal muscles without putting too much strain on that lower back. How we do it is we first lie on our back with our knees bent and feet flat on the floor. Placing your hands across your chest or along your thighs, we want to engage our core, lifting our shoulders up off the floor, keeping your lower back pressed flat against the ground. We want to hold this position for a moment at the top, then slowly lower back down. We want to shoot for 2 to 3 sets of 10 to 15 repetitions. This exercise strengthens the core muscles, providing better support for the spine and helping to alleviate the pressure off the lower back and the discs. Now remember, with exercise, consistency is key. We want to start slow and gradually increase the intensity as your strength improves. And as always, if you experience any discomfort, please consult a healthcare provider before continuing. Now you have a concise guide to distinguishing between SI joint dysfunction, sciatica, and disc bulges. Remember to consult your healthcare practitioner to confirm any diagnosis and develop a treatment plan. You are now better equipped to understand your symptoms and take proactive steps towards relief. Now, I want to hear from you. If you have any questions, please leave them in the comment section below. We'd love to hear about your experiences with lower back and leg pain. What treatments or exercises have worked well for you? What has not been effective? Share your insights to help others in our community. Now, if you found this video and these exercises helpful, be sure to like and share so others can learn about this too. Also, go ahead and subscribe right now if you want to learn more ways to enjoy a life free from pain and filled with health and joy. The next video you should watch is this one. You will learn the best sleep postures for sciatica, disc bulge, back pain, and leg pain. Go ahead and watch this video next.